and 95.3 FM, W237BD Boca Raton, the Health and Wealth Radio Network. Talk health, talk wealth, talk politics, talk 1470 and 95.3 FM, WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. But we're going to change that up tonight with a curveball. We have an LPN on the program, and he's going to be talking a lot about HCR Manor Care. I know you know that name because they're across the U.S. They're also known as Heartland as well, and we'll get into that. But I want to give a little bit of the bio out of our guest here, made it in studio. I'm so happy to have Joshua Perez. So he is nurse liaison, LPN, at HCR Manor Care, or as we know him here in Delray Manor Care Delray as well. So without further ado, welcome to the program, Josh. How are you doing this evening? Is it Josh or Joshua?
It's Joshua Perez, and thank you guys so much for having me. I'm extremely excited and ready to give some information to the South Florida community today.
And we'll keep it as Joshua. You know, I had some issues with my Gmail today, so I'm sorry we didn't get connected, but that was one of my questions. But yeah, we wanted to have you on the program. Obviously, there's a lot of care out there, especially in the South Florida market. I always tell people, you know, on this show, have a Rolodex in your mind, you know, for the future. I'm coming to that age right now where I'm kind of stockpiling different things, you know, for the future. So I'm always looking for, you know, a great cardiologist or great neurologist just to keep in the mind, but also is care for, you know, this is care that when you've been discharged from the hospital or care later in life is so important. And there's so many different options out there, but we know your name. So tell us a little bit about Heartland-Manor Care and their specialty.
Absolutely. Well, again, thank you for having me on. And Heartland of Manor Care, we are a nationwide facility. We have about 221 facilities nationwide. And last year we took care of over 150,000 different clients. So we are the 15th largest World Health Organization after our purchase of ProMedica last year. And we specialize in ensuring to get our seniors and anyone else who may need a bridge home, we work on getting them back home as soon as possible with the greatest outcomes and results. And in addition to that, providing them with some of the most excellent care here in South Florida and across the nation through our other 221 facilities.
Oh, wow, that's a huge network. Yeah. Now, Joshua, you said Bridge Home a few times. So is this a facility here in Delray Beach, and we'll give out the info here in a second, is this a facility that is for someone who needs to rehab and then maybe get back home, or is this also a facility where someone can go to live and, you know, the family can take that burden and that thought off of their minds of having, you know, their loved one in a skilled facility?
You know, that's a great question, and we are absolutely providing to both. So we do offer long-term care, And as well, we offer short-term care for anyone who may have an elective surgery, someone who may be sick, who maybe needs some nursing care before they get home and may not have anyone at home to take care of them. We can help bridge that gap. And in addition to that, we have a plethora of different resources, whether it be home health, assisted living, different physicians. There's so many different resources at our facility, and our big goal is just to make sure that we can take care of as many people as possible and return them to their home, to their loved ones in a reasonable amount of time.
And that's so important because that's quality of life for the individual and also for the family and relatives as well. And if you just saw me type in there, we are on Facebook Live, All County Healthcare's page, All County Healthcare INC. So that's what I was up to. I am in tune with you here, Joshua. But thank you so much for joining us this evening. We kind of turned a little. We normally have doctors on this program about 90% of the time, and then also nurses as well. We've had a lot of ARNPs and nurse practitioners on the program. But today, like I said, to start out, we're getting into baseball season, spring training. I kind of want to throw a curveball. We've done so much general surgery and cardiology with Heart Month last month, which I am going to ask you a little bit about. But so it's great to have you again. It's Joshua Perez, nurse liaison, LPN with Manor Care Delray. Where are you guys located? You're, did I look, is it Jog Road?
Yeah, so we're located, the exact address is 16200 Jog Road. We actually have 7 sister facilities here.
Whoa.
Yeah, so we actually have 2 in Boca, 2 in Boynton, 1 in Delray, and 2 in West Palm Beach. So we have quite a few different facilities, and in addition to that, our Delray one, we're closest to Delray Medical Center. We're about a mile away. We have an incredible amount of different physicians that work at Delray Medical Center that do follow at our facility. And another wonderful thing is that if for any reason a patient has to go back to the hospital, Delray Medical Center is our 911 hospital, so they go back to the same doctors who have already been with the care before, etc. and so forth.
And what a hospital to be affiliated with. They're an A-plus hospital, the gem of the Tenet system, and really great hospital. I know a lot of great cardiology, vascular. We were talking a little bit about Dr. Ricotta in the green room because he's like the rock star of vascular surgery around here the last few years. So with limb salvage as well. And I was talking how I actually attended a few of the surgeries, and it was just amazing. So I'm glad. But he's been on the program. So Delray Medical Center, great hospital to be affiliated with. Cardiology, neurology, vascular, ortho, as well as their other programs. And we're going to talk about some of those medical topics a little later in the program because I know your organization does so much. So we've talked so far about how you help the seniors of South Florida and baby boomers and that elderly population. One of the big questions everyone has nowadays with anything is cost. Now, does Manor Care Delray take insurance, or is it private pay? How does that work?
Absolutely. So we accept just about every HMO, Medicare, and private pay. We probably have maybe 4 or 5, just a very small handful of, the very rare type of insurance companies that we may not have a contract with. But for the most part, we accept all contracts. And if we don't accept your contract, we usually work with your company to see if they'll do a one-time agreement. But we do everything that we can to make sure that if you're able to get into our Manor Care facility, you're taken care of. And most times, insurance usually pays for it. You usually don't have to pay for anything. And when you go home after your stay with rehabilitation, most times your insurance company will provide you to have home health and physical therapy. In addition to a few other programs that we have, we also offer a concierge program specifically at Delray. So when our clients go home, we'll usually get them free transportation over to their home. We'll make sure to stop by the grocery store and the pharmacy, make sure that they have everything, because usually when a client is going back home, the first 48 hours are their biggest chance for readmission. So by us making sure that they have all their medicine, they have appropriate food, they have their transportation home with no issues, we also schedule a 4-hour home health aide that is completely paid for by the facility, just to make sure that when our clients are home, they stay home and they have somebody who's there to make sure that they help them progress and transition with whatever they may need.
And I know you guys also make sure the home is a safe place, because that's another big thing, falls nowadays with the seniors. A fall could really lead to a chain of events that could lead to death in some cases, and
Absolutely.
traumatic brain injury. And then there's broken bones, women with osteoporosis, men with osteoporosis as well, same thing. And yeah, it's just good to have someone, if you are coming out of the hospital, someone who knows what they're doing, can see all the red flags and help you out. You mentioned an interesting thing. You guys would go grocery shopping for them. I know your company, you were telling me, actually did something with a grocery store in Ohio because they felt like the community was malnourished in that area.
Yes. So last year, we were purchased by ProMedica and Welltower. We became the 15th, again, largest health organization. And what happened is that we found out in ProMedica up in Ohio that we were looking at the community, and the community, they noticed that a lot of their patients were coming in malnourished. They were coming in with extremely high blood sugars, extremely high, cholesterol levels, and they realized that there was a little bit of an epidemic. So what they started to do was, as opposed to treating patients with normal modern day medicine, which, as you know, right now, a lot of clients take between, maybe 10 to 15 medications at a time. Sometimes polypharmacy is a very big thing right now. So what they decided to do is, we do food surveys. We'll see a client, and if they fail the food survey, we'll write them a prescription. And this is something that we will adopt down here eventually. But in Ohio, they will write a prescription for that patient at the hospital. When the patient comes over to the grocery store, they will have a certain amount of funds that are appropriated to them to make sure that they have food that is specific to whatever their comorbidity may be. If they're diabetic, we're going to give them food for their diabetes. If they have, cardiac issues, we're going to give them food for cardiac issues. Whatever it is, we're trying to take a different route in using food as medicine. And it's something that we're very proud of, and I think that it's going to change the way we look at healthcare and how we start looking at healthcare in the community first, before they even get to our hospitals or our skilled nursing, and we're treating the symptoms there. We're trying to be proactive and preventative to prevent them from even getting there and lower our healthcare costs.
That's great. You just said some great things. Community, preventative, that needs to be more of a focus in the U.S. It all starts in the community, the way we eat in different communities.
Agreed.
I mean, it really does. And then helping out that town in Ohio, nutrition, I was just jotting down a couple things. It helps with well-being, keeping you healthy. That's almost like a preventative medicine in a way. But then it also helps with healing. And a lot of the people you're dealing with are coming off of those traumatic falls or maybe even traumatic brain injury. I know you guys do. Diabetic care, oncology, ortho and joint, pulmonary care, stroke and neurological, wound care. All these are things that we've talked about in this show the last 3 years because they're such at the forefront of the ailments that are, hurting people today. So that's great news. I'm glad you were able to share that because, no, that is great news. I'm going to get it out there. Again, it's Joshua Perez. He's an LPN. So that's, tell me what an LPN is.
So an LPN is a licensed practical nurse. We basically go through about maybe 1,500 hours of clinical hours, and we basically are the front line when it comes to making sure that, our patients there are taken care of. And then when you become an RN, they add the theoretical base. It's also, an LPN is, this is what's going on, this is how we're going to stop it. And an RN is, this is what's going on, this is how we're going to stop it, and why has it happened? And they take it one step further.
That's great. So you're a nurse liaison. So you actually go out into people's homes and as well as at the facility, Heartland-Manor Care.
Yeah, so most of it is really at the facility, but if there's someone that is at home, we do take people from home all the time. You don't necessarily need to be in a hospital in order to have these. There's certain steps that you could do if you're at home so that we could move you into the skilled nursing facility as well.
And it's HCR-Manor Care, MANOR care.com, HCR-Manor Can I give out this number too as well?
Of course you can, yes sir.
954 area code, our friends right here, 954-995-7336 as well. We're getting a lot of great info from you, Joshua, and I got to tell you have a great radio voice, and you know a lot about Heartland-Manor Care. I'm in PR, and they may want to put you out front a little bit more.
Well, I'll tell you, I truly believe in their product, and when I tell you that I've worked for a few different companies, and I can truly say that with this company, especially with ProMedica backing it right now, I truly believe in the product. I have so many different stories, and just the short, I've been up here in Palm Beach now for 6 months, and prior I was in Broward and Miami-Dade, and in just the short 6 months that I've been up here, I've seen some of the most amazing stories, and the teams that we work with. Palm Beach is just a beautiful place with our team, and I'm just so ever happy to be working with them, and I truly, truly believe in their product.
Yeah, because you were down in Hialeah just a little while ago,
Yeah,
right?
it was
Glad to be up
ways
here.
away.
It's great down there as well. We have some hospitals down there we were talking about.
Yeah.
Let's take a quick break, and on the other side, I want to ask you, this is interesting, the trach program for tracheotomies, what HCR Manor Care is doing to help the community with that on the Living a Longer and Healthier Life show. No one called.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hey, South Florida and beyond, welcome back to the Living a Longer and Healthier Life show this evening with HCR Manor Care. Joshua Perez, he's an LPN, that's a nurse liaison is his title over there. HCR-manorcare.com, 954-995-7336. And I'll give out that info again. They do a ton with short-term care, long-term care, outpatient rehabilitation, cardiac care, diabetic care, oncology, ortho and joint, pulmonary care, which I do want to ask you about because All County Healthcare INC does a lot with pulmonary as well. They do HCR Manor Care also does stroke and neurological care, wound care, which is very important nowadays with the diabetes epidemic. We're always talking to vascular surgeons and podiatrists, and all they want to talk about is wound care. So we know how important, if our doctors are coming on this show talking to us about it, it is to get the word and awareness out on it. Before the break, Joshua, I wanted to ask you a little bit about the trach program because my last 6 years in PR, I've spent a lot of times in hospitals, and I never knew much about tracheotomies. It's a very common procedure for a lot of different reasons to alleviate signs and symptoms that are affecting the human body, but these trachs, they need to be taken care of after you get out of the hospital, this type of this tracheotomy. So tell me what HCR Manor Care is doing with their trach program.
Absolutely. So at the moment, Manor Care of Boynton Beach is already up. We're accepting trachs. We have a great program that's going on over there. And at the moment, Delray, we just got a brand new director of nursing. She's been with us probably for about a month, and her background was working in acute hospitals with people who may have had trachs, vents, everything that dealt with respiratory. So we're extremely excited to be bringing her on. She is extremely knowledgeable, and we're hoping that here in the next quarter, we will be able to have tracheostomy care over at Delray. And you're absolutely right. There's a lot of people that do have this, and unfortunately there's not a whole lot of skilled nursings that do accept. There are some, and a handful of them, and we're happy to be getting on that list with other ones as well. And we have Dr. David Kateb, who is actually a physician over at Delray Medical Center, who is starting a pulmonary program with us. And the pulmonary program has been proven to be successful, and we've decreased our recidivism, which is our readmission rates back to the hospital already. And moving forward with Dr. Kateb, he's been at other facilities where he's brought it down from 45% to about 15% of readmission. So we're extremely happy to have him on board, and we're looking forward to taking care of people and helping them with any pulmonary issues that they have with this new protocols.
That's great. And I just want to piggyback on that. All County Healthcare Incorporated, the sponsor of the show. You can see all the shows on their website. They have the library there under the radio tab, so allcountyhealthcare.com. And on Facebook, the shows are all there on their Facebook page as well. They do, and we had it right here, they do an IPV treatment, intrapulmonary ventilation device treatment for COPD is one of their big things that they do, as well as a ton of home care. So pulmonary care is huge nowadays with, the problems with, smoking over the years. And then also people work in different environments. I didn't know this until I got into healthcare PR a few years ago, was people work in environments like sandblasting and stuff. You can get some lung ailments from that, even if you weren't a smoker. And if you were a smoker on top of that, but then there's even like secondhand. Me and you just breathing the air, we could come up with pulmonary problems. So pulmonology, definitely I'm big on that focus too. And the other side of that is sleep apnea, which is affecting all different ages of the population as well. So
it's interesting you say that, because you're absolutely right. It doesn't necessarily have to be a smoker. You can be exposed to painting all your life and you could be exposed. You could be working in attics and deal with issues like that.
Yeah, one thing about most air we can't even see most air is odorless and colorless except for the smoke. So you don't know what we're really breathing in. It's
a very, very, very good
And this
point.
goes back to that Rolodex there. You gotta always have people in your Rolodex. If a friend or family member comes down with something, and use that as your network to your advantage. Know what's out there as well. And we know that you guys are great. It's HCR Manor Care. It's hcr-manorcare.com. Great website. I got a ton of info. Before I knew the name, I'll be honest with you, I didn't know much about you, so I'm glad you came on, and we have some viewers on Facebook Live as well. So
hi there,
see
guys.
out there, that's great. One thing,
joining.
people share the show, and it gets in front of a lot more people. You get a few viewers, and that's how it works. So we're big on that as well. One person we didn't mention, you're also tied into medical director Dr. Manuel Espinel, did I get that right? And he's at Delray Medical Center, right?
Absolutely. So Dr. Manuel Espinel is probably one of the big physicians there, and in addition to him being one of the big physicians there, he's actually our medical director over at Delray Medical Center. A lot of other physicians follow as well, but him with what he does over there, it's a wonderful thing to have him with us. He is so great with our family, so great with our clients, and he really does care. And in addition to that, he holds an extremely high reputation over at Delray Medical Center. So he's our medical director, and if there's anyone that you want seeing you, it's him.
Yeah, it's a great hospital too, level 1 trauma center. So you have some big players in the medical community already that you're affiliated with. And you were telling me, mention again, the 15th largest World Health Organization is HCR Manor Care?
Yeah, so we were purchased by ProMedica. ProMedica at the moment owns a bunch of urgent cares and hospitals.
Okay.
And now from an urgent care and a hospital, now they own skilled nursing facilities. So we're kind of keeping a cyclic kind of rotation. If you're at our hospital, we're trying to send you to our skilled nursing facility and keep you all within that same bundle so that you can expect a better continued care when you do go to your post-hospitalization.
Nice.
Yeah.
How did you become involved with HCR Manor Care?
So I've been now with the company for 2 years. I've been working with seniors for about 10 years now, and I was very fortunate while I was in Miami-Dade County to have run into my boss. And once I heard about the product, I was working for the competition. I didn't really know too much about HCR Manor Care, and when I found out about the products, the education they give back to the community, I fell in love with the product. I fell in love with the people, and I help probably. I mean, last year we took care of 154,000 people across the nation.
Wow.
85% of them went home, the others needing assisted living or long-term care. But I am absolutely in love with the product. We take care of people, and we are just excited to be here and just letting you know about the HCR Manor Care product, and we hope that we can help some other people in the future.
Yeah, definitely. And you have a lot of passion for it, and I can. You have great energy. You're a great spokesperson for them as well. And I think that's what people need, when they're in healing. They need someone who has the resources, the network, and just a great attitude about helping them get better to back to a quality of life that they had before, And if it is towards the end of life, that they also get that quality of life, and their relatives and friends and family are, happy.
And I can tell you that the team and me, we share the same passion. It is truly about helping people and making sure that you guys get back into the community as timely as possible with your loved ones.
We got less than a minute, so I'm going to give out the address of the Delray location, because we mentioned that a few times. Manor Care Health Services Delray, 16200 Jog Road, so 16200 Jog Road, Delray Beach. The website is HCR-manorcare.com. And thanks so much, Joshua, for being on the program. We'll have to have you on again in the future.
Thank you so much. And everyone, that's a 24/7 line. Feel free to give me a call.
Thank you. We'll see you next time on the How to Stay Healthy show.
Thank you, guys.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were